The world continues to watch the COVID-19 pandemic. Recently, scientists have identified a new variant called NB.1.8.1. This variant is now a topic of discussion for health experts globally. Understanding new variants helps us protect ourselves and our communities. I'm NB.1. 8.1 first appeared on the world stage not too long ago. Its emergence reminds us that the COVID-19 virus is still evolving. The rapid identification of NB.1 8.1 shows that global surveillance systems are working. Early information is key to preparing a good public health response. The initial reports about NB.1 8.1 indicate that it is spreading quickly in some regions. This rapid spread is a key reason why it has caught the attention of organizations like the World Health Organization. When a variant spreads fast, it can lead to more cases of COVID-19. This can put pressure on healthcare systems. As we learn more about NB.1, 8.1, public health officials will provide updated guidance. It is crucial to listen to these experts. Let's delve into the details of this new variant. The new COVID-19 variant NB.1 8.1, was first identified by scientists in China in January 2025. Like many other variants, NB.1 8.1 is a descendant of the Omicron variant. Genetically, NB.1 8.1 is quite interesting to virologists. It is described as a recombinant variant, a mix of genetic material from different versions of the virus. Specifically, it is a recombinant of another Omicron subvariant known as XDV.1 5.1. NB.1 8.1 also has additional mutations in its spike protein. The spike protein is what the virus uses to enter our cells. Changes here can affect how easily it infects us or evades our immune system. Because of its genetic makeup and rapid spread, the World Health Organization has labeled NB.1 8.1 as a variant under monitoring. This designation means that health authorities are watching it closely. Early data suggests NB.1 8.1 might be more immune evasive. This means it might be better at getting around the protection offered by past infections or vaccines. Scientists are working hard to confirm these characteristics through laboratory studies and real-world data. Since its initial detection, NB.1 8.1 has been identified in over 22 countries. This includes nations across different continents such as the United States, Australia, and several countries in Europe. This wide geographical spread shows how interconnected our world is. Some areas have become particular hotspots for NB.1 8.1. In China, where it was first found, NB.1 8.1 has reportedly become the dominant strain of the virus. This has led to an increase in hospitalizations in some parts of the country. Australia has also seen a significant impact. For example, the state of Victoria reported a notable rise in COVID-19 cases linked to the spread of this new variant. In the United States, cases of NB.1 8.1 were first detected in late March 2025. These initial detections often occurred through airport screening programs. Travelers arriving from countries where NB.1 8.1 was already circulating were among the first identified cases. As of mid-May 2025, NB.1 8.1 accounted for nearly 11% of all sequenced COVID-19 samples globally. This data underscores the dynamic nature of the pandemic and the need for continued vigilance. When a new variant like NB.1 8.1 emerges, people naturally worry about symptoms. The good news so far is that the symptoms of NB.1 8.1 appear largely similar to those caused by earlier COVID-19 strains. This includes symptoms commonly associated with other Omicron subvariants. You might experience a sore throat, fever, a persistent cough, and general fatigue. The list of possible symptoms for NB.1 8.1 also includes chills, shortness of breath, congestion, or a runny nose. The loss of taste or smell, a hallmark of earlier strains, can still occur. Muscle aches, headaches, nausea, or vomiting and diarrhea are also on the list of reported symptoms. It is important to remember that COVID-19 can affect people differently. Some may have very mild symptoms, while others could feel quite unwell. If you experience these, it is wise to consider getting tested. A key question is whether NB.1 8.1 causes more severe disease. Based on current data, while it appears to be more transmissible, it does not seem to cause more severe illness compared to previous Omicron variants. Dr. Umesh Adalja, a respected expert in infectious diseases, has stated that this variant does not pose an additional level of concern regarding severity compared to other Omicron variants. This perspective is shared by other health professionals. So while it might not make you sicker than other variants, more people could get infected due to its high transmissibility. Understanding both the symptoms and the potential severity helps us react appropriately if we or our loved ones fall ill. A major concern with any new variant is how well our existing vaccines work. Current information suggests that the COVID-19 vaccines we have continue to offer good protection against severe illness from NB1, 8.1. While you might still get infected, being vaccinated significantly reduces your risk of hospitalization or death. Staying up to date with recommended vaccinations remains a key defense strategy. In the United States, there has been some recent discussion about vaccine recommendations. U.S. Health Secretary Robert F. Kennedy Jr. announced changes that limit vaccine recommendations primarily to seniors and high-risk groups. This decision has sparked debate among health experts. Some worry it could affect vaccine coverage and potentially lead to increased out-of-pocket costs for some individuals. The FDA's Expert Vaccine Committee met on May 22, 2025, to discuss updating vaccines for the upcoming fall and winter season, considering newer variants. The FDA committee recommended continuing with a vaccine formula targeting JN.1, another Omicron subvariant. However, research into next-generation vaccines is ongoing. Public health responses in different countries may vary based on local situations. Health authorities continue to advise vigilance. This includes wearing well-fitting masks in crowded indoor places and practicing good hand hygiene. Staying informed and following health advice is our best path forward.